If you're able to empower a practitioner to step into an operatory, perform a comprehensive diagnosis, know what they're going to communicate to a patient, reduce chair time, enhance the clinical outcomes, then it really is a win-win-win for everyone involved.
Hello, everybody, and welcome to another episode of the Raving Patients podcast. As you know, I'm your host, Dr. Len Tao. These episodes are sponsored by Cloud Dentistry and DocSite, so check them out if you can. I'm super excited to talk about a new dental technology I learned about back in February of this year. The technology is going to change the way the dental industry, in my opinion, is forever. The way we analyze x-rays, the way we discuss x-rays with patients. I met this gentleman and Mike Buckner, formerly of Weave and Solution Reach, at a Catapult meeting, and I was truly impressed. I needed to get them immediately on my podcast to talk about this new technology. So we're going to be talking to the CEO and founder of Pearl, and his name is Ophir Tanz. Ophir, thank you so much for joining me today. I look forward to spending the next half hour, 35 minutes with you talking about this new technology that you just got FDA clearance on. So thank you for joining me today.
Thanks, Len. It's great to be here.
So let's start off with your background. Why don't you tell the viewers and the listeners a little bit about who you are, what your background is, how you got involved in this space in the first place?
Yeah, absolutely. So I have a sort of a serial entrepreneur background. I've started a number of companies. I went to Carnegie Mellon where I got my bachelor's and master's in sort of a business computer science combo program there. And I've been involved with a technology called computer vision, which is a sub-branch of AI, for really the past 16 years professionally. I've been working on commercializing that technology for quite some time now. And my roots and relationship with that technology go all the way back to my time at Carnegie Mellon. So my previous company was a company called GumGum that was leveraging artificial intelligence and computer vision and more of sort of the media and marketing world. And we grew a very successful enterprise there, grew it to well over $1 billion in value. And it was actually at GumGum where I began to incubate what is now Pearl. So way back in 2015, I got interested in applying this technology more widely and particularly applying it to healthcare. Just because, my belief is this is a very powerful technology. It's going to permeate all aspects of our lives in positive ways. And I really thought that me and folks around me were in a position to continue adding a lot of value to the world and want to do something fundamentally, really meaningful. So I had actually gone to my dental practice at the time one day, and I was going in for a routine checkup. And I said, "Hey, I'm interested in applying this technology to dentistry. Would you guys share some data with me and maybe get involved?" And Dr. Stanley, who's now our chief clinical officer, kind of overheard my conversation with another practitioner there. And he was very interested and eager to get involved. We started having him come to the office once a week and then twice a week and then 3 times a week. And eventually came on full time. And initially it was exploratory. Hey, could we effectively identify, dental pathology in radiography? And over time, we saw that we could, and we began to analyze the market and felt that there was a really profound change that we could help enact in the field of dentistry, really help to elevate the standard of care in a very fundamental and profound way. And my father actually is also a retired dentist, so I kind of grew up in that environment. And that's probably a big reason as to why I wanted to apply here, although there are others. And if you look at dentistry, it really is a field where, every few decades you have some sort of dental technological innovation that comes into play. It could be the intraoral scanner or the toothbrush or, radiography or digital dentistry or discovery of fluoride, right? Any number of things that happen typically once in a lifetime, maybe twice. And they profoundly impact the category and elevate the standard of care, and nothing's ever the same. And I do believe that is currently happening with artificial intelligence. And in some ways, I feel that the impact that this technology is going to have on the category will be even more profound. And the reason for that is because we are able to elevate the standard of care in day-to-day dentistry for every patient in the world. And I do believe this technology is going to find its way into every dental practice globally in a relatively short period of time. But if you look at specialty, if you look at the payer side of things, if you look at things like correctional facilities, orthodontics. I mean, there's a huge amount of application here across not only different types of radiography, but also intraoral photography and intraoral scans that you could bring this technology to bear on to really just improve efficiencies and improve accuracy.
Yeah, that was a great intro. Obviously, like I said, you have the background to really take this to the next level within the industry, and I'm excited to talk about it. I did speak about it at the Utah Dental Association, and during my session, as I told you, it was the one thing I got so many questions. I was like, "Tell me more about this technology." So I definitely want the viewers and listeners to hear this. So before we get started on artificial intelligence, why don't we explain to the listeners and viewers exactly what Pearl does? There's a specific thing it does. Can you just go through that? I don't want it to be a sales pitch, but people are not going to necessarily know or heard of Pearl. What does Pearl do? How does it help dentists?
Yeah. So Pearl, our website, by the way, is hellopearl.com for anybody that wants to check that out, to say that early on. So we do a number of things, but the thing that we do fundamentally that powers most of the rest of what we do is we're able to look at radiography and using machine learning, artificial intelligence, computer vision, we're able to detect and identify pathology, existing restorations, and natural anatomy. And that all happens in real time. We are also the only company in the world that is FDA approved to apply and use this technology on the disease detection front in an operatory and generally in an office environment. And that's not only now domestically in the US, but that's also across 50 countries worldwide.
And the FDA clearance just came very recently. So that was a big change too. So let's talk about dental AI. Artificial intelligence is a term that's very loosely used nowadays, unfortunately. And I think a lot of companies say they do AI, but they don't really do AI. So can you kind of give the viewers and listeners an overview of what artificial intelligence actually is?
Yeah, it's a great point. I mean, every company is now somehow an artificial intelligence company. Uh, this all started really with the advent of sort of modern neural networks, which came to be really in 2010. This is a very old technology dating back to the 50s and 60s, actually. But because of a variety of hardware progress and innovations, it sort of came back into fashion and is now extremely effective. I've been involved with this technology before it was the hip, cool thing to do. And we were even applying it before then. But this really did supercharge what you're able to do with this technology, this advent of machine learning and neural networks, in our case, something called convolutional neural nets. And effectively, what you're doing with artificial intelligence is you are training a machine, much like you might train a child, or a human mind to understand things at a conceptual level so that understanding becomes generalized and applicable. And what I mean by that is if you want to, for example, teach a child how to understand what an apple is, you might show them, a few instances of apples and say, this is an apple, this is an apple. Show them it, 10, 15 times, maybe 5 times, and they get the concept of apple. A machine is very different. Machines require historically explicit instruction sets. And what that means is you need to describe an apple in excruciating detail on the curvature and the colors and the stem and the leaf and all this stuff, right? And that doesn't work well. It's not generalizable because then you see apples in all types of different environments, in the trash can, on the ground rotting, cut up on a plate, in the hand of a monkey, whatever the case may be, and the computer generally will fail at that identification. What you're able to do with AI is feed a massive amount of examples of apples to this neural network. And it on its own starts to understand the features and the characteristics of what composes an apple. It really is kind of like an alien intelligence coming up with its own understanding of what this thing is. And then you could start feeding it new examples of imagery and asking, is this an apple or not an apple? And it'll, at a very, very, very high degree of accuracy, show you whether or not it is or it isn't. And of course, in this particular use case, we're talking about dental pathology and other types of detections. And what we've shown in standalone trials and our clinical trials is that we are able to, outperform human performance pretty much across the board with various types of disease and other detections.
Gotcha. When we met in Arizona, Mike Buckner had that deck that said that, I don't know if there was 100, and I don't remember the exact 139
136. I remember that deck.
136. Yeah, 136. Were asked, what they found on a specific tooth, and you got so many different answers because it's really a subjective thing, and the price range from zero all the way up to like $5,000 on a tooth. So it's very interesting with the subjectiveness of X-rays to see that we have another tool, just like Diagnodent was a tool. We have another way to help determine whether there's actually pathology in someone's mouth and use it to be able to make a clinical decision as to whether we want to open up a tooth or treat it.
That's exactly right. And I think one other common misconception is that, for example, tooth number 3, I remember in that peer-reviewed study, it was about a 50-50 split between folks that identified caries and folks that didn't identify any caries. And that's an important feature of dentistry that we should really acknowledge, is that a lot of this stuff is open for interpretation, and there are such things as borderline cases, right? This technology is called second opinion. It's not intended to remove any autonomy on the part of the practitioner. As an assistive device calling areas of interest to their attention. So you have things like, interproximal caries or early bone loss or, periapical lesions or calculus, right? These things are really, really easy to miss. And what this technology does is sort of calls attention so that every diagnosis can be more comprehensive. And the other thing that it does, and I don't want to get ahead of the conversation here, but it also acts as a very powerful patient communication device. Because when you're able to overlay oral anatomy and show third-party, identification by AI of disease, and you want to now explain and sort of paint a picture for a patient about what's going on in their mouth and how you want to treat it, it suddenly is much more clear because you're not pointing to, one gray blotch and then another gray blotch, and it's really hard to see these things. But the technology isn't perfect. It is like a human mind. It improves over time, and there's different thresholds of certainty and uncertainty. Something called an F1 score, which is this notion of sensitivity and specificity. And it's intended to sort of work in tandem and in partnership with the practitioner, not in any way to replace their read of radiography.
As I said, it's an adjunctive tool to help you make a decision whether you're going to treat the tooth clinically. And I look at it similar. I don't know if you heard of technology called the Canary system. It was a way to use a laser to detect the fluorescence underneath fillings, because one of the most difficult things we have in dentistry is the ability to see under a filling on an X-ray. And I was an early adopter on that technology. I was the first dentist on the East Coast to actually bring it into my office. But what I remembered, and I was on TV for it, but what I remember about it was I was able to convince patients who we were watching their silver fillings. I was able to convince them by using this scanner or this tool to say with certainty that there was decay underneath a silver filling. And when I would open it up, it was huge. We've been watching something that was so big that we should have treated it years earlier. So this is just another great tool for that reasoning, is to really convince patients that they need to go ahead and get treatment done. I think it's great from a case presentation and a case acceptance perspective. So let's talk about the significance of the FDA clearance, because prior to that, I don't want to say it put things in a different way, but that changed the way you can, talk to dentists about using your product.
Yeah, it really is a profound moment. And the reason for that is, in order to really extract the full value of this technology, you want to be able to use it, in an operatory environment. You want to be able to use it to show patients what is happening. You want to be able to potentially integrate it into other, imaging softwares. And this is the kind of thing that the industry, has specifically been waiting for at least a couple of years now, is which company is going to be able to get FDA approval on this capability so we can really fully sort of extract all the value. So this FDA clearance that we recently received is really just that. It's extremely comprehensive. All types of common pathologies, like I said, existing restorations, and that does enable you to now show it to patients and use it in really a clinical environment for clinical purposes and do all these integrations, all this other stuff. I do think there is confusion in market on this point. I think other companies that have no FDA clearances whatsoever or have other FDA clearances are trying to sort of obfuscate things and claim that they do. And I think that's kind of dangerous because we're dealing with patient health here. But it really is sort of a watershed moment because it makes the technology just that much more useful on a day-to-day basis.
So talk about prior to, I want to really touch on this FDA clearance because I think it's really important. Prior to getting the FDA clearance, what were the limitations of using the software? And now that you have the FDA clearance, what did that open up from your perspective as well as from a dentist perspective?
Yeah, it's a great question. So prior to FDA clearance, we actually have been operating, in Europe, in the UK, in Australia, and Canada. So we have a lot of experience in deploying this technology in clinical environments because we have been cleared in those territories for quite some time now. The FDA came later. Prior to the clearance, the ability to use it in a clinical environment is very limited, because the FDA does require that you actually have clearance in order to use this in a patient-facing and other manner. So before this, there were severe limitations. You had to potentially sign up to an IRB and you part of a study, and you couldn't pay for it, and it was really sort of a stepping stone to what we were very actively trying to achieve, which is to receive FDA clearance. So now, whether it's in the hygiene room or in the front office or in the operatory, with our tool set, we really furnish all stakeholders in a practice in varying ways and empower them by virtue of this technology. So it's not only the practitioner that we're servicing, it's really every stakeholder in that practice, including management. And now they're really able to sort of use this in the full way in which it was intended.
I mean, that's great. That's great. So let's talk about, we talked a little bit about artificial intelligence, and I laugh when I hear, now that I know about what your company does, and I see these chat bots that say they're artificial intelligence, and it's like frequently asked questions. It's like a joke. I hate to say that, but it really is funny when people say we have artificial intelligence.
It's a sexy marketing lingo to say you're artificial intelligence, but I would point out that artificial intelligence is so fundamental to what we do that if you were to take it out of the equation, we wouldn't have anything. We wouldn't have a company at all. There'd be nothing, right? It's all built on the back of that capability fundamentally, and it's all also completely visually apparent that that's the case. Other companies, I think one good sort of litmus test is, could I remove artificial intelligence from your company? Could you still function? And I think generally the answer is yes, which means that it's probably not super core to what they do.
Exactly, 100% so. Obviously, if you remove the artificial intelligence from what you're doing, you don't have a product, basically.
Yeah, exactly.
So let's talk about the impact of artificial intelligence on clinical care. Obviously, I think we've touched on that a little bit already, but specifically, what is your comments on that?
Significant, hugely significant. And I say that by virtue of a variety of case studies that we've organized. They are available on our website to view as well, at least some of them. And really, there's a couple ways to look at this. So one is, if you think about it practically, what we do on day one with our Practice Intelligence product, for example, is we go back in time. We look at your previous, 18 months of data, and we develop a series of funnels. And we say, okay, for endodontic treatment or implant or restorative or impaction, whatever the case may be, what has been planned, what has been treated, and what has actually been identified by the AI. And you see huge deltas there. So just on day one, when you're looking at sort of the total story and narrative of a particular practice, what you see is a massive amount of two things. One is under treatment, but also under diagnosis. Because if this has been noted in the PMS, we're not going to call it out as sort of a new opportunity. And what you generally see in dentistry is an epidemic of undertreatment and underdiagnosis. A lot of people focus on this notion of overtreatment and fraud, and that is sometimes an issue, but by and large, a vast, vast, vast majority of dentists are not engaging in drilling and filling kinds of fraud. Those are very egregious cases, but very, very, very few and far between. But if you look at any practice, I will guarantee you that there is a significant underdiagnosis situation occurring there. And it's often because they sort of are, getting focused on treating one thing but ignoring something else. So there might be bone loss, or there might be sort of an implant opportunity, or any other number of pathologies that are getting missed. If you look at it on a day-to-day basis, where we try to make it very simple to utilize this technology in your practice in a way that is very low touch and high yield. In other words, we're going to color code your schedule. We're going to call out where action is needed, and it's up to the practitioner to sort of do what they would like to do with that. But what we have been able to show is up to $11,000 in incremental production being driven per week in your average practice. And that's a combination of turning unscheduled to scheduled, which we happen to be very effective at. That's not really AI, but we're effective at it. Is reminding folks of certain tasks like, hey, this patient needs a new FMX set. We're also effective at that, not AI. Most importantly, misdiagnosis, diagnosis opportunities, bringing that to attention, and then creating a treatment plan around those opportunities. And that in itself is, just over $3,000 per week on the restorative side. So we're talking about sort of massive opportunity here, and it's really exciting because if you're able to empower a practitioner to step into an operatory, perform a comprehensive diagnosis, know what they're going to communicate to a patient, reduce chair time, enhance the clinical outcomes, then it really is a win-win-win for everyone involved. And that's why we feel it's such a powerful tool. This notion of walking into an operatory, pulling up the radiographs for the first time when you have a huge amount of other responsibilities to tend to during that day and doing a cursory review just doesn't cut it. And this tool just eases that burden significantly.
And just to be clear to those viewing and listening, there are really two parts to the product. One is the analytics side where you go back, is it 18 months or 24 months back to take a look at their x-rays and do analysis and make predictions, tell them what they missed, tell them what they may have missed, tell them what may be predicted in the future. And then there's the second opinion, which is the forward-facing side, which you can show the patients.
That's exactly right. So, yeah. So second opinion is purely sort of diagnostic. Only integrates with an imaging system. Very straightforward to install and get set up on. And Practice Intelligence is a more super powered tool where we are also integrating with your PMS and able to surface a huge amount of additional insights. Even things like daily call sheets for the front office that are AI powered and things like that.
Gotcha. Okay. So we talked about the impact of dental AI on the now. What about it on healthcare more broadly?
Yeah, so I actually am hugely excited about this topic because AI has not arrived to dentistry first, right? It arrived to other medicine, forms of medicine first. But there hasn't been the kind of uptake that everyone expected was going to occur 10 years ago. Everyone thought radiologists, would be sort of unnecessary by 2022, and everything would be AI powered in this fundamental way. And what you found is that really hasn't been the case. And there's a number of reasons for that. I actually advise a few companies that do this kind of work for other forms of radiography. Not in dentistry, but things like brain cancer and lung nodules and stuff like that. And what you find is a huge amount of friction in that reality. First off, there's not that many radiographs to get access to. They tend to be hyper sensitive. And what you find is that these companies have to spend often millions of dollars just to acquire some small set of radiography. And they need to base their entire technology off of whatever they've been able to access in order to sort of train the AI. So there's a limit of data. And so that obviously has an impact on efficacy. And then you have these other friction points. So, for example, you finally sort of raise a bunch of money, you train the AI, you sort of get FDA approval. Hopefully, it takes a long time, and you're sort of very hobbled in your ability to. But let's say you do that. Okay, well now I want to go sell into Kaiser Permanente. Well, that's going to take you another 5 or 7 years, right? Because that's a massive hospital group. And then you have this customer set that is sort of inherently somewhat threatened by the technology because this is wholly what they do. If you're a radiologist in another form of medicine, this is sort of what you pride yourself on. And this is what you do day to day. So you're going to have a bit more resistance to this technology potentially because you're threatened by it. Whereas, dentists are not, full-time radiologists. This is something that they have to do in order to do their job. They have to do it well. And for that reason, they're much more open to receiving this kind of assistance. Plus, dentistry is a very entrepreneurial class. It's very nimble. It tends to like new technology. So we're able to push these capabilities out that are already better than what you see in the rest of medicine because we have access to so much more data. And we're able to just drive better, faster outcomes. So for those reasons, we really do believe that dentistry will absolutely be the model for how to apply AI in medicine. And as it gets applied more widely, we think that this is going to really be an area that general medicine pulls from for inspiration and best practices.
I think that's awesome. And then what do you expect from artificial intelligence on the dental side in the future? Where do you see things going?
Right. So right now, it's really about fundamentally elevating the standard of care. simply by virtue of integrating this technology into a dental practice, you are going to accomplish that with every patient that comes into the operatory. So that is the way to really start to generate just the day-to-day value here, and it's immediate, and that's really exciting. And with second opinion, given that it's a very functional technology, that we have regulatory approvals across most of the world, and it's a very easy to integrate technology. We anticipate that is going to happen in maybe a 5 to 7 year period. You will really see this being infused into dental practices worldwide. So that's kind of step one. And then there's a whole host of other things you can do, right? We have, currently we're primarily focused on 2D. So things like, bite wing, periapical, pano, stuff like that. We are working aggressively on 3D capabilities. We are working with clearinghouses and payer groups to help create and bring to market this promise of real-time adjudication. So that is something that practitioners are really excited about, but payers are also very excited about. We think that AI really lends the ability to actually bring this dream to fruition. You also have this notion of value-based care. So value-based care is this concept that's been around since the 70s, and everyone says, if you drive good preventative dentistry, we want to reward you. Well, it's impossible to actually quantify that without the use of AI. But with the use of AI, you suddenly have quantitative metrics that you're able to refer to and reward practitioners for great care. We're doing a huge amount of work in every kind of specialty that there is, whether it's ortho or implant or endo, helping to surface these cases and working with specialty groups and sort of the sort of workflow and GP communication aspects of what's going on. So really, I think this is all just, and it's still at a very nascent stage. But what is exciting are the outcomes. If you look at our clinical studies that we did with the FDA, we'll be publishing some of those results. We're showing almost 40% increase in misdetection. So there's just, again, a huge amount of pathology that is present that we at least want to take note of. We're not promoting anything on their treatment side. We're not promoting more aggressive treatment, but we are promoting, hey, let's be aware of this stuff so that we can track it over time so that we can be responsible stewards to our patients.
Something I thought of, we talk about getting data into a system and then out of it and analyzing things, garbage in, garbage out.
Yeah.
Just as something that I wasn't planning on asking, but it just came up. How does the quality of the radiograph affect the ability to detect for your detections to take place?
It's a great point. So garbage in, garbage out, definitely true on the radiographic side, and it's definitely true on the PMS side as well. If you've developed all types of exotic treatment codes that nobody's ever seen before, and you're kind of running that common operation, and you install practice intelligence, which we have seen occur, it's not, it's somewhat seldom, but it occurs, then we have to account for that. And because we're doing this in so many countries worldwide, we see lots of different PMS systems, and we also see lots of different levels of quality on the radiographic side. So, a lot of phosphor plate work, especially in the EU, for example. If you have sensors that are, outputting poor resolution imagery, or have a lot of artifacts on them, or are not tuned correctly, or are blown out, or everything's a cone cut, it's going to affect the detection accuracy in exactly the same way that it would affect the detection accuracy if you were to put those radiographs in front of a human. That really is kind of a one-to-one. If a human's going to have a really hard time reading a very, very, dark or blown out radiograph, then so will a machine.
Gotcha. I think that was important too. And then the last question I had was, can you just let the listeners, viewers know a little bit about how the machine learned? I know it was how many million X-rays or a million X-rays that you uploaded into the system for it to learn a little bit about, how to read these X-rays. So can you talk about that a little bit here?
The training and learning process?
Yes, correct.
Yeah, so basically what all machine learning entails, and this is a form of machine learning called supervised learning, which is most common, you need to bring a lot of expertise to bear on the labeling and annotation side. So what we've done is we've literally worked with hundreds and hundreds of practitioners and radiologists to painstakingly annotate radiographs over many years. And there's a series of measures that we bring to bear to actually validate the accuracy of these detections. And then what you do is you sort of run it through a series of learning models, and they learn, and you test, and it learns, and it tests, and you do more and more of that, and more refinement. And because we're using this not in a university environment to do a proof of concept, but we're using it, in clinical environments, the bar is set very high, and it's set very high by the FDA. So we bring a lot of pre-processing to bear. So we clean up, radiography before we do any processing, and then we bring a bunch of post-processing to bear. So we might say, because we understand the anatomical structure that we're looking at, and we understand the tooth parts, we know what situations are impossible. For example, so we might do a form of post-processing where we say, hey, there's a caries detection here, but we know that that's impossible because it's in some part of the mouth that you can't have a carie, and you sort of remove false positives that way. And it's just a huge amount of effort. So that's why this is such a years long, tens of millions of dollar type of endeavor, because so much needs to be brought to bear to identify so many detections. We are unique in that typically, if you look at an AI company in medicine, they're identifying one thing and one thing only. We're identifying like well over a dozen things, and that's growing every day. So we've actually had to bring fundamentally new statistical models to bear in our clinical trials with the FDA to validate efficacy for those reasons.
Perfect. That was great. This was great content. I want to spend a few minutes, as I do in all my episodes, going over these questions, this little lightning round Q&A. So I'll read you the question. It's on the business side of things. It's called the hustle. I'm going to read you these questions. You can answer very quickly, just, what your answer is. You don't have to go into long details. But so the first question is, what important rules have you learned about business that make you more successful?
Honestly, my advice in business is very straightforward. I mean, I think we could spend hours talking about this topic, obviously, but what I see folks fail to do time and time again, especially in high growth, sort of tech startups, which is primarily my history, is just a lack of focus on being practical. Am I driving value? Am I listening to my customers? And is my original thesis about the world actually make sense? And does it hold up with this new information that I've received? So we all have to start with the thesis, especially when you're building something fundamentally new and inventing a new market. And what you find over time is, what you believe to be true and what still feels like should make sense, intuitively and fundamentally, just doesn't for any number of reasons. And you need to be able to maneuver around reality and get closer and closer to this notion of what is real versus what do I love as this pretty picture that I'm painting in my mind and my investor's mind. So just returning to reality and being practical, I think is a boring answer, but a very important thing to remember and adhere to.
I think that's great. So, what business related book has inspired you the most, or what is your favorite book?
Oh, that's a great question. One book that I really do love, which isn't necessarily a business book, and it's a very short book, is a book called Lessons of History by Will Durant, who's probably the foremost historian of our time. Well, he's not passed away, but really of this generation. And he wrote the sort of histories of every ancient civilization, but he kind of distilled all of his learnings down into this short, 130-page book. And I just find that to be a tremendous guide to better understanding humanity and life, and in all aspects. Another great book by a controversial figure is Peter Thiel, but Zero to One, I thought, was one of the most insightful business books I've also ever read, and I think it's just worth noting, and I would encourage everyone to read that, especially if you're building a technology startup.
Well, I appreciate that. I've heard of that book. I haven't read it myself, but
Yeah.
I heard some great things. So, who has been your greatest inspiration?
Honestly, maybe also a little cliche. I'm a huge fan of Steve Jobs. I know he had some personality issues, but I think what that man was able to accomplish and deliver to the world, and I actually think his adherence to aesthetics and sort of just pushing the entirety of sort of humanity forward. Like I have probably a different view of him than a lot of other people do. I just think he's so massively impressive and inspiring that he's high on the list.
Yeah, I'm a huge Apple. I mean, you can't see my studio, but I'm Apple everything.
Yeah, we just bought an Apple. We just bought an Amazon Fire tablet for the plane ride over here. I'm on Hawaii right now, like we discussed, for our young child to play with, and I was just like shocked at how crappy the thing was. and it makes you
Yeah,
appreciate
it's
like
an
all
Apple
all that.
iPad is like there's no
It's
comparison.
no
The
comparison.
quality is that much higher. That's why you pay for it. So,
Yeah.
what is something you wish you had known when you started out?
If you're an entrepreneur like me, and even if your dad's a dentist, you're stepping into new industries that you are not native to. And I think it's really important to be humble about that and to surround yourself with people that understand the practical challenges that the industry faces on a day-to-day basis and the dynamics of that industry. I feel much more embedded in the industry now than I was, but certainly if I had all the knowledge that I do now, and I'm obviously still learning on day one, I think we would have been able to develop even better products faster.
Perfect. And last question: what mindsets have helped make you successful?
Again, I think if you do what I do, there's an expectation to grow quickly, and that's sort of the nature of VC-backed companies. And because I've started a number of these, I think that just managing your own psychology on a day-to-day basis in a healthy way is very important because when you're doing something like this, there's just a lot of challenges. There's 50 new problems a day. Some of the things could seem existential. And what you find over time, if you maintain a cool head, you're going to work as hard and probably react the same way, whether your hair is on fire or you're very calmly and stoically sort of going about your task and your communication to your team. So this notion of just having your own strategy, not being too focused on what's going on around you, listening to customers, servicing those customers, and again, updating your thesis to reflect the realities of the world tends to lead to positive outcomes. At the end of the day, we're looking to drive value. We're looking to generate better patient care, and that's just what we're here to do, and nothing else really matters.
That's terrific. So, as we wrap things up, if somebody wants to find out more about Pearl, you already told the website it's hellopearl.com, but how can they get more information about what you do, how you do it, a little bit about the product? What's the best way for them to do that?
Yeah, I would recommend going to the website and hellopearl.com and actually signing up for a demo. So we're happy to get one of our folks to speak to you about how you can utilize the variety of tools that we have in our practices. If you're already convinced, you can go through some self-service signups as well. But I certainly would encourage folks to visit the website. There's a lot of insightful information there and videos and blogs and other material like that. But just go ahead and schedule a demo and we'll chat about it.
And then, did you want to offer? I know we talked about it very briefly in the beginning because you asked about the date of release. Did you want to offer anything to the listeners of the Raving Patients podcast?
Yes.
For pricing, pricing or specials or something?
Yes, I'm told we're offering 10% for a year off of any of our products. So both Second Opinion and Practice Intelligence. And that will be done via a discount code that I believe you'll distribute.
Okay. All right. Perfect. And just make sure they know if they speak to someone, they should mention that they heard about, the product through the Raving Patients podcast or myself or however it is, but through me. Well, this was very enlightening. I have to be honest with you. I'm going to be stopping clinical dentistry in the next, within another year or so maximum. So this type of technology gets me really excited. I kind of wish I'm going to stay in dentistry, but, that isn't in the cards, obviously. But I'm super excited about this. I was super happy to get you on the podcast and have you explain to the viewing audience and listening audience a little bit about what Pearl is. I think every dentist needs to bring this into their practice. It will change the way you look at radiographs. It will change the way you present things to your patients. I'm excited to be bringing it into the office soon in my practice, or what was my practice. So if you like this episode, please share it. Please let your colleagues know. Please promote it. Please like our page. Please subscribe to the episode. Our episodes come out Friday at 5 a.m. in the morning. So your new episode will be in your inbox if you do subscribe to it. Ophir, thank you so much for joining me today. This was awesome. It's a little longer than they've run lately, but I didn't want to cut it off because I thought it was really important to get as much information out about the product as possible. But thank you so much for joining me again. And as I always end my episodes, always remember your reputation matters. Until the next episode, we'll talk to everybody soon. Ophir, thank you so much for joining me today.
Thank you, Len. Real pleasure. Appreciate it.